Which one of the following is an established indication for the use of botulinum toxin? Strabismus, Hirschsprung's disease, blepharospasm, Bell's palsy, upper limb rigidity, and Parkinson's disease. While answering this question, we need to pay attention to the word established. We might use botulinum toxin in all of these disease entities mentioned in this question. But we need to mention or to pick the most widely accepted and approved indication for botulinum toxin. The correct answer is blepharospasm. Although it's also very useful in cases with strabismus, but in the MRCP we would consider cases with strabismus is somehow restricted to ophthalmology, but blepharospasm is something in neurology that's called dystonia that we need to be aware of. So there are many indications for botulinum toxin, like in cases with essential tremors. Botulinum toxin injections may be helpful for limb or even voice tremors. Treatment might be complicated with muscle weakness. Botulinum toxin might be used to control focal tics, and again it causes muscle weakness. It might be used in primary focal hyperhidrosis, where there is excessive sweating of the palms, which might be disabling. The solution to this would be to do T2 sympathectomy. As you know, this is a spinal cord, this is cervical ganglion, and sympathetic nerve supply goes to the sweat glands of the palm, and it releases acetylcholine. It's sympathetic, and it releases post-ganglionic acetylcholine. So we can block this by using botulinum toxin. It might be used in focal neuropathic pain, might be used in resistant migraines and chronic headaches. All these depending upon small, might be non-blinded, might be not enough evidence-based to support or to acknowledge the use of botulinum toxin in these situations. It might also be used in gastroparesis, like in diabetic gastroparesis, by injecting it into the pylorus to help emptying of the stomach. And it might be used in constipation, including Hirschsprung disease. So if you inject it into the anal sphincter, this might help emptying of the intestine. But the most established indication is dystonia. Dystonia is a movement disorder which is characterized by sustained or intermittent muscle contractions. So the muscle keep contracting like spasm. Dystonia is something like spasm because the movements are repetitive. It has many types, like the focal, multifocal, segmental, combined, or complex. These three are established to benefit from botulinum toxin injection. These might include the focal group, might include blepharospasm, might include torticollis, lateral collis, or anterocollis, just various combination of neck muscle contractions. So the botulinum toxin acts by blocking the release of acetylcholine. So it blocks the release of acetylcholine at the neuromuscular junction, hence reducing the dystonic muscle contractions. Treatment might be associated with muscle weakness, and this is a case in rigidity associated with Parkinsonism, for example. It still can be treated by botulinum toxin, but the problem is it causes weakness of the muscles. The problem with this weakness is if we are injecting a torticollis, for example, it might involve the neck muscles and the swallowing muscles, which might be troublesome. There is no systemic side effects from botulinum toxin injections. The problem is the benefits are transient and required frequently or on repeated courses. The second problem is some patients have initial response and then they don't respond to botulinum toxin because they have developed neutralizing antibodies.